Good afternoon, everyone. My name is Irene from Infection Control Department. Would like to welcome you all on my live stream today. Our topic for today discussions is regarding basic infection control for the first session, and next will be infection control overview. So for now, I'm waiting for my participants, and then this is my attendance as conducted by infection control. Let me check first. conducted by infection control. Date today is July 5, 2021, of course. Our topic for our session is Hello, Basic Infection Control Orientation. This is actually continuation for the last discussion. Basic Infection Control. We are here now in the lecture or and then as of preparing for this, our reminders for lecture hall protocol is wearing masks and social distancing because we are here in the lecture room. And I have a newly hired staff again coming for today, so I need to discuss again for another orientation. So prepare for this. Okay, this is our first topic. So this one. Come, doctor.
لا يشبك معك يشبك معك يشبك معك يشبك معك يشبك معك الميدان مكان
Welcome, doctor.
الطلب بتاعه يعني حتى لو قلت لك بس انا قلت لك ان شاء الله خير ان شاء الله خير
No problem. Dr. Samar is here. Yes. Take your attendance. I will start now. While
Sa yung attendance, magsulat ka ng presentation. Mag-attendance, ha? Ano yung attendance?
take your attendance there.
Welcome sisters. My beautiful sisters. Where is my beautiful sister? Oh, very bad. ما في بنسيب ما في لبسي ما في نقالي
Oh, when Sunday, when Asya.
ما في
Ellie, close the door.
ما في شرم ما في
Ano spelling? Yes. German? Siya nakakasulat ha?
Ako, sagalatan na nga.
Malay ko. Swalya. Ade. Binda din yun.
Tinda-tinda ka.
Oh, ano? Ang tagal naman.
الدكتورة الإنجليزية أخبار الله يديك العافية حبيبي الحمد لله باشا الحمد لله طيب وما شرفني بكرة على الإمارات تعالى فرجك على المستشفى نطلع نكتب على الشهر الله يديك العافية شكرا هات لي بس بالله الصورة بكرة كده ماشي عويلة الترخيص وترخيص وزارة الصحة والتصديق
Okay, have a seat. We'll start now. I'll have a time. Have a seat. Welcome, Samar, the senders of Okay, let's start. My attendance is there. Just sign for Miss Samar. Okay, let's start. Quiet, please. The back. Let's start. We will start for the first session, huh? The basic infection control. The last time we have also lecture here with the group of the newly hired. And I know they will come also for those waiting, but we need to start now, okay? Start for the basic infection control. What is the basic infection control? This you need to know, especially the newly hired one. Okay, we have our content, we have introduction, the definition of infection control, our purpose, the standard precaution scope, the type of infection control precaution, the key elements of standard precaution, types of transmission-based precautions, and the summary. Those all that I mentioned, it will discuss one by one. And what is infection control and prevention? Our infection control addresses factors related to the spread of infections within the healthcare setting, whether patient to patient, from patient to staff, and from staff to patients, including prevention via hand hygiene, hand washing, cleaning, disinfection, sterilization, vaccination, and surveillance, monitoring, investigation demonstrated or suspected spread of infections within a particular healthcare setting like here. It is in the basis that the common title being adopted within healthcare is infection, prevention, and control. And why is infection control important in healthcare facilities? Why? See, is a question mark for it. You see? And this is it. Every year, lives are lost because of the spread of infections in hospitals. Healthcare workers can take steps to prevent the spread of infectious diseases. Welcome to here. Okay. The purpose is to reduce the occurrence of infectious disease. The diseases are usually caused by bacteria, virus, and can spread by human to human, animal to human, and with an infected surface through different transmission mode. It's required to prevent the transmission of communicable disease in healthcare settings to prevent cost, overstay, suffering, emergence of MDRO in setting, risk of acquired infection, legal consequences. What is MDRO? Miss Samar? MDRO, Ate Malo? The newly hired. You know? This is your multi-drug resistant organism. So there are a set of standards recommendations used to reduce the risk of transmission of infectious agents from body fluids or environmental surfaces that contain infectious agents. You listen because we have a short quiz after. And we have type of infection control precaution. The standard precaution and the transmissions-based precaution. In standard precaution, this is a set of infection control practices that healthcare personnel use to reduce transmissions of microorganisms applied for all patients and clients and healthcare facility. What is the transmissions-based precaution? Are used for patients known or suspected to be infected or colonized with microorganisms and should be applied with standard precaution. Okay, I already discussed the last time, but I just need to because we have newly hired. We have in our transmission-based precaution, we have this to follow the steps. We apply it according to color coded. Contact, droplet, airborne. This is our transportation card that we use here in our facility, especially in the isolation. You will see this in the ante room. It was posted there. It's if it's contact, what's the color? It is green. Sa green. She knows already. And this step will guide you to prevent you from infections. Next. Airborne. What's the color of airborne? It's blue. And you see this in our isolations. Next, the last one. Droplet. What's the color of droplet? Red. And it was laminated and not text because I only show you how. Especially the new one. If you have case in the isolation, you must follow these steps. You will guide it of this reminder. This poster is very important for us. This will save you, especially if the cases. Example, the cases is HEPA B. What is this? What's color coded? You will apply. If HEPA B is the patient, if cases your patient is HEPA B. Red. You miss somewhere. Red, what's the color coded we will use if the patient is HEPA B cases? It's contact. Why? It's contact. That's one, contact. Because your HEPA B is considered as our contact cases. If it's TB, what you will apply? This is no airborne. Yeah, there. That's. And I have a note here. Transmission-based precautions are used according to the clinical syndrome and likely physiological agent. That's why we have this. You see, you will get this. Yan. Our standard precaution scope. Standard precautions are evidence-based of clinical work practices published by CDC. So, if you need something more clarification or you need to something more educational, need you to have more, what is the standard precaution? You can check our website in the CDC. And I have references that I put here in our lecture. And update that prevent transmission of infectious agents in healthcare settings. Previously known by various names including universal precaution. Standard precaution are the basic level of infection control prevention. Hospital infection is the result of a combination of factors. Microbial source plus transmission plus susceptible host equals what? Infection. Okay. Standard precaution apply to blood body fluid secretions, non-intact skin, mucous membranes, handling items contaminated with blood and body substance. Red alert, must be practiced standard precaution with all Compliance, that's why alert. Yeah. The key elements of our standard precautions. Number one, your hand hygiene. What's the meaning of hand hygiene? Is the most effective way to prevent the harmful germs. The gloves, the masks, Google face mask, gown. What you call this? PPE. What is PPE? No. What's this acronym? What's PPE? Acronym. Hmm? Very good. Yes, I know she's new. She's the one from India. Prevention of needle stick and injuries from sharp instrument. Respiratory hygiene and cup etiquette. How do you do your cup etiquette? Flex your elbow like this. Okay, good. Environmental cleaning, patient care equipment, and then waste management. Now, hand hygiene. Hand hygiene is the single most important practice to reduce the transmission of infectious agents in healthcare settings. And the third, hand hygiene includes hand washing with either plant or antiseptic containing soap and water, use of alcohol-based products, gels, rinse, foams containing animal that do not require the use of water. This is your, we have this, and we have also dispenser. We have complete the one with in the area. And then you will, inshallah, if we have time, you will do demonstration. If this one. Okay. Next. The rationale is transient flora contaminating or non-colonizing, attached to the superficial layer of the skin. Microbes isolated from skin not consistently present in majority of persons associated with HCAI. What is this? This is another acronym. What's that? HCAI. Healthcare associated infections. So we have many acronyms. Who will answer? I will give you the burden. Resident flora attached to the deeper layer of the skin, persistently isolated from skin of most persons. Yan. How to hand wash again. This is written already. I know you know this already. And we have many posters here in our facility. So it's easy for you. How many seconds how to do the hand rub? Oh, the bulk. Hmm? 20 to 30. It's there. Now, this is your hand rub. See, I have also here this one. Can you see this? Oh, see, the hand rub is only 20 to 30 seconds. And hand wash is 40 to 60. Hand wash with the use of water. Okay. Okay, how to hand rub and how to hand wash. Now you know. Normal resident flora does not pose a significant risk to patient while transient flora does. Potentially harmful microorganisms, and then hand washing can remove germs. The single most thing that you can do to stop the spread of any germs is to wash your hands. 1, 2, 3, 4, 5, 6, 7, 8. Okay. The 5 moments for hand hygiene. This is before touching a patient. before clean aseptic procedure, after body fluid exposure risk, after touching a patient, after touching patient surroundings. You have each like OR, like in the ICU, you have a big sa 5 moments of unhygiene kabir sa. Yeah, you will not be lost. The last time when we surveyed the MOH camp, she asked this. Yeah, in the ICU, especially in the NICU, especially in the ER. When she comes, she asked the staff. Now, PPE. This is your personal protective equipment. The mask, the gowns, the face shields, the gloves, and the goggles. The surgical mask, the N95, the yellow gowns, the blue gowns, the face shield, the clean gloves, the sterile gloves. See, it's specified. It's extra. Personal protection equipment. Types of PPE, gloves, gowns, apron, mask, goggles, and face shields. The sequence for donnings. When you say donning, it's mean putting on. Yeah, put on. And then it's doping, put off, okay? And their sequence. The hand washing counts. What's this? Mask, okay? Face shield. And the last one, gloves, The sequence for removing of the PPE. First is gloves, but then wash your hands. Next, what's this? Face mask. And then your gowns. And the last one, your mask or N95 mask. And then, the first and the last step that you will do is hand hygiene. See? You start from the hand hygiene, you will end on the hand hygiene. That's why. Now, gloves to be worn when touching blood, body fluid secretions, excretion, non-intact skin, and contaminated items. Must be removed promptly after use. Hands must be cleansed immediately. Must be changed. Change between what? Oh, at the back, the OPD. Between procedure, between patient, between clean and contaminated site. Do not wash or reuse the gloves. And do not dawar-dawar using your gloves. Gowns or apron. Wear a gown or apron if clothes or skin likely to become contaminated. Remove solid gowns promptly. Do not reuse for repeat patients' visits. Okay. The mask, the eye protection, and face shield, they are only one. Use it spraying or splattering lightly. This is useful what area? Your dental unit, dental sister. Use face shield that covers front, sides of face. Use combination of masks, goggles, face shields for respiratory protection. Yeah. Surgical mask and then N95 mask. This is the type of mask. Surgical mask and the N95. It is designed for protection against droplets, including large respiratory particles, and do not prevent leakage around the edge of the mask with the user or inhales. In N95, it is designated to provide respiratory protection for the staff. It has a filter efficiency level of 95% or greater against particulate aerosols free of oil. And by the way, before you wear N95 mask, last thing you should have a whole fit test. Fit test. And then the use are used as a physical barrier to protect the user from hazards such as splash of large droplets of blood or body fluids. That's the difference. Used with the staff exposure to certain airborne particles in a site rate of 0.12, 10.0 microns, such as TB or MERS-CoV, our MERS-CoV. Then place on sick people to limit the spread of infection for respiratory secretions to others. The size of surgical mask is one size like this. This is surgical mask. When I finish, I'll throw. It's disposable, not to use again. And single use and disposable, yes, no. There is a note for N95. No, nobody here from ER because they are. I always give them one box of 95, and then another day. Then use until damaged. Breathing becomes difficult or contaminated with blood or body fluids. Otherwise, it might be stored or used according to the facilities. According to the facilities infection control policy, our policy can use. It is still valid and intact. And then put after that in a resealable bags. We can put now according to the last survey. You can put now in the more on the what's this paper, like a paper pouch. Prevention of needle stick and injuries from sharp instruments. Place in a puncture-proof container. And this is the one. This is our. Yes. This one is our. You will see this sign, biohazard sign, and then you will. There is a level only until there is a level 4 here. Again here. You are a nurse, even you are not the one who will. You should know when you it's already 3/4. You call the cleaner to remove the changes. And then it must be always closed, not open. And then the important one is the sticker. Who will collect? There is infectious waste sticker. The hospital name, the department, who is the person, type of waste, what's inside, and then collected name, who collect sample, shahin, like that, and then signature and date. This is the one you will put on the top when you remove it. Be needle smart, do not bend, do not remove, do not recap, do not transfer, and do not reuse. The sharp container. You see? The risk of transmission of bloodborne infection, occupational exposure, and risk of transmission. The hepatitis B virus is 2 to 40%. The Hep C virus 2.7 to 10%, and the HIV is 0.3% in 300 chance of infections. How can needle stick injuries be prevented? Okay, of course, employees training. You need a continual training for you must attend for this. Then recommended guidelines is according to our references, the standard guidelines. Safe recapping procedure. What do you mean by this? Safe recapping procedure. Your scoop method. You know your scoop method? Scoop method. You know scoop method? Then effective disposal system. Surveillance programs and improved equipment design. What should you do if you do accidentally prick yourself with a dirty needle? What you should do? If possible, put the prick area low the ground to promote bleeding. Do not squeeze. Do not like this. You will squeeze, no. And then wash properly with under running water. If it splashes to mouth or eyes, rinse thoroughly with plenty of running water. Then inform the head nurse, fill up the needle prick injury form. I did not bring, but I have. But next time, maybe next week, inshallah, the sharp disposal will be the next one. And then we have a form for this. We have complete form for the separate form from the OR for the needle prick injury form. During working hours, go to the staff clinic. See, this is the rule. You will go to the staff clinic and out of duty hours, go to the ER for further management. In who are the doctors for our staff health clinics is Dr. Marwa Kamal. There, this is the one I'm telling, the scoop method. And then aseptic technique. Refers to procedures performed under sterile conditions, defined as a set of specific practices and procedures performed under carefully controlled conditions with the goal of minimizing contaminations by pathogens. Hazards of needle stick injuries, the hepatitis B and C, HIV, brucellosis, malaria, disease is Staphylococcus aureus, Staphylococcus pyogenes, toxoplasmosis, and tuberculosis. Patient care equipment. Clean, reusable equipment before use in the care of another patient. Clean, disinfectant, and sterilize. Do not reuse single-use or disposable equipment on other patients. Respiratory hygiene cup etiquette. Cover your mouth and nose with a tissue with cup and sneeze. If no tissue, cup or sneeze into your upper sleeve. That's one of your cup etiquette. Then you must wash your hands. Don't use the palm of your hands without tissue. Yeah. Cover your cup. If you're coughing, you must cover. The signage of entrances or lobby provide the tissue, provide hand hygiene instruction, and supply, okay, for your patients. The environmental cleanings, the surface clean and disinfected. Terminal cleaning after patient discharge. Disinfectants are used according to manufacturer instructions. The 5 environmental control must have adequate procedure for care, cleansing, and disinfection of environmental surfaces. Focus on frequently the touch areas. Start from clean to dirty, from out up to down. Yeah, that's the for waste management. Ensure safe waste management should be contaminated with blood, body fluids, secretions, and excretion as clinical waste in accordance with local regulations. What is medical waste? Is the yellow bug. Yellow bugs. Sana. Fluid blood less than 20 ml of volume. Okay. Yeah. With the importance the biohazard sign symbols. It's good, yeah. The what's that? The yellow bug. The biohazard symbols. It's the important one, like that. And the bloods. See, I and what is the non-infectious waste? This is your regular waste, the black bag. Fluid blood less than 20 ml volume. Okay. That's it. Tissue. See? No, the cleaner not here. Anyway, I have also doctor for the cleaner by next week, separate for yeah. And the red dog, what is pathological waste? This is inside the red dog. Yeah, it is important, especially to the cleaner. But even you as a head nurse, you must also. Isolation precautions. Transmission-based precaution. This that I mentioned. This also. Type of transmissions-based precautions is your CDA. What is CDA? Contact, droplet, airborne. What's the color of contact? Green. What's the color of airborne? Blue. And the droplet is red. Okay. Contact precautions. Contact precautions are intended to prevent transmission of infectious agents such as MRSA. What is MRSA? Methicillin-resistant Staphylococcus aureus. See, now I mentioned the acronyms that I show you the first part. The multi-drug resistant organism, as in the Bacter, hepatitis A, which are spread by indirect contact and direct contact. What are the precautions applied to contact transmission? Your hand washing, gown, and gloves. Okay. Droplet precautions. Droplet precautions are intended to prevent transmissions of pathogens spread via the droplet nuclei less than 5 micron through close respiratory or mucous membrane contact with respiratory secretions such as meningococcal, meningitis, mumps, rubella. They call it MMR. MMR. It was here. I will show you that. Now, what are the precautions applied to droplet transmissions? Your single room, surgical mask. If you have notification or notice, keep the door closed. Keep the door closed. The airborne precautions prevent transmissions of infectious agents that remains infectious over long distances with suspected in the air, such as PTB, chickenpox, and measles. Oh, take note. PTB, chickenpox, measles is under airborne precaution. This is the one telling you if the patient, example, you have patient and it's TB, so you will apply your airborne precaution and you must be alert of it. And then once you have a patient, example, in the ICU, this is the one you will put on the front door of the patient. Sorry, this one you will put in the front door. Okay. TB germs are spread by an infectious patient through air droplets. Persons become infected. What are the precautions applied to airborne transmission? What are the precautions applied to airborne transmission? Your negative pressure room. We have negative pressure in the isolation. Glassing. Negative pressure. We also have then N95 and then keep the door closed. Then transportation, surgical mask on patient means you will have surgical mask when you transport the patient. Surgical mask on patient means you will give mask to the patient. This is your contract droplet airborne. Same. Now, the biological spill procedure. Indication for use to clean of blood and body fluids. Kit contents the gloves, the Clorox, the paper towels, yellow bag, and forceps for broken materials. The procedure, you will wear bar gloves, apply powder over spill, pour around the spill with Clorox 10%, cover the spill with paper towels, allow the bleach solution to up 10 minutes, then clean up the spill. Clean up the spill with additional paper towels, discard towels, gloves, and other waste into yellow bag. Remember, for any explanation, contact with infection control link. Don't forget to read the infection control policies and procedure in your facility. Infection control Control is the responsibility of all staff in the facility. So anything that concerned regarding for infection control, you can inform me directly in my office. Our number is room 360. Room 360, my dear. And then, but then I will get your number also because we have a group, WhatsApp group in infection control. The summary. Now we are in the summary. Everything you touch, everything you touch, like the telephones, computers, your mobile pens, books, tables and chairs, doors, has been touched by someone else. You always remember that. Before you go, someone come. Maybe the one coming not wash hands. You go bathroom, not wash hands. Ha? Muskila. Then maybe unwash. Thanks for washing or thanks for watching? No, thanks for washing your hands. See? Hands. Infection control is everyone's business. Infection control is everyone's business. Family and visitors to the hospital, therapists, physicians, ambulatory care center, administrators, clerks, environmental services, patients, nurses. They mentioned. And thank you. Next is our infection control overview. This is a really good discussion. Yeah. The one is okay. Okay, our next is infection control overview. This is the last. Our next is infection control overview. My name is Erin, still your speaker for today from infection control department. Okay. We have objectives, generalized background about infection control, differentiate between control and prevention of infection. You will know what's the meaning of these very simple words. Different varieties of implementations of infection control. Infection control and patient safety. Infection control is a culture, not a program. Identify the economics and cost benefits of infection control. Florence Nightingale. It may seem a strange principle to enunciate as the very first requirement of all hospitals that to do the sick no harm. You know who is Florence Nightingale? Very good. Hmm? See? What's the meaning of this? Huh? You can explain to me? The abstract of this picture. And what is infection control? A discipline that applies epidemiologic and scientific principles. In scientific means your guideline standards for this. Epidemiologic means your the concern example is your laboratory report. Statistical analysis, your surveillance reporting, like my statistics daily that we had. The prevention or reduction in rates of nosocomial infections. What is the difference between control and prevention? Control, it's very simple, it's more about influencing what's already happening. Again, control is more about influencing what's already happening, and prevention is stop something from happening. Stop something from happening. And then the major function of infection control is to protect your patient and to protect yourself, especially now. We are still ongoing the hospital-acquired nosocomial infection versus healthcare-acquired infection. Microbiological background. Microorganisms. Organisms which can be seen by microscope to live warm temperature, moisture, and darkness. And aerobic versus aerobic. Anaerobic microorganisms which live in an environment without oxygen. Aerobic is microorganisms which need oxygen to live. The non-pathogenic versus pathogenic. Non-pathogenic is a microorganism that does not cause disease. And pathogenic is a microorganism which is disease producing. By the way, you already signed attendance. You finished na the attendance? Pathogenic of microorganisms, the bacteria can be treated with antibiotics. The viruses smaller than bacteria cannot be treated with bacteria. Okay, protozoa, the larger than virus, grow within the host cell. This is theory. Huh? Fungi, the low form of plant life, includes molds and yeast. How microorganisms spread? How? Direct contact, transmitted directly from one person to another. Then indirect contact transferred from one object to another. And how microorganisms spread? The airborne carried in the air. Oral route enters body through water, food, and dirty hands. Insects and pests pick up on insects and pests and transferred. The global infection problems Average of 8.7% hospital patients suffer HAI. Developed countries 5 to 10%. In developing countries, risk of HAI 2 to 20 times higher. HAI may affect more than 25% of patients. The impact of HAI, the healthcare associated infections, increase patient suffering, lead to permanent disability, lead to death, prolonged hospital stay, increased need for a higher level of care, then increase the cost to patients and hospitals. Preventing infections requires healthcare providers who have knowledge of common infections and their vectors, an attitude of cooperation and commitment. Skills necessary to provide safe care. Then global hand washing is for the month of October. The standard precaution. Now they mention again. Yan. This is your precaution standards. Donning and removing PPE, we mentioned this. Or perform hand hygiene, put on gown, put on mask or respirator, put on goggles or face shields, then put on gloves. Then remove the gloves, remove the gown, perform hand hygiene, remove face shields, remove mask or respirator, and perform hand hygiene. You must know this because if there is survey, they ask this, the one. And then not only ask, they will perform you. They will ask you to demo the return demonstration. Most of them, especially in the ICU. Especially in the ICU. The last time they asked doctors if you can ask Susan, the head nurse, she always asking regarding this. The sharp management, your sharp management, you know, some nurses not come, but they should know this. Okay, blood and body fluid spill management, the waste management, infection control management. All hospital staff is speaking monocultural language. Next. Thank you. For a while, I will just for a quick for the newly hired and also to you because it considers this is you attend only now. Na? What month you come here? I'm not here, sir.
Kami, volunteers.
No, you. How many when you join the work here? What month you come? Alright. Wait, I will explain to the and then we can. Okay, for the newly hired, of course, this is you need to fill up this form, our baseline screening for newly hired staff. Your HEPA B, you will write your HEPA B, HEPA C, HIV, TB. The employee's immunization. Huh? You will write your name, date of birth, your sex, what I mean is if you are female or male, civil status, job number, department, position, date of hire, especially nationality, and then your contact number. Then the vaccination schedule. So you will fill up this. What's the name? Atene?
Abira.
Atea. Atena.
Abira.
Atena.
Abira.
Atita. Okay. Atita. Welcome to our hospital. Yeah, you will fill up this. I will give to you. But also to you, I will give it. Come. Give to because and then this one, where's the other,
At si Irene, don't know. What about paracetamol and flagyl? And safety box?
what?
Paracetamol and flagyl. And safety box?
Yes, this. Paracetamol, yeah. Because this is considered only in the yellow. Kasi supposedly we have I don't
It's
know.
small.
Yeah, the small for the needles, syringes. But now this is the oh yeah. If not available, you can use this also. Same, only big.
That's in yellow.
Yeah. This. Yeah, and not in the yellow plastic, huh? Yes. All sharps pointed. Anyway, like next week we will discuss. We have topic this. It's nice. And then the staff health checkup. This one also for you. But you just write only in the book.
My stuff?
No, you. They did not attend. And Miss Atin Tena. Okay. And then after that, you will have certificate like this, huh? I will only select the who will come. Okay, I will give those. This is your certificate. After finish all this. Then the last one, you will answer, bring it, and you can give me tomorrow in my office. The three of you. Very easy. Yes, if you answer. Yeah, for you. You. Yes. Because you attend, that's it. That's it. No, I have this in your, don't worry this. All of these are already in your. Just answer that. Another one for the newly hired, this lady. You are from India, your name, date of birth, job number, medical records number, the department, the position, date of hire, the nationality, and the contact numbers. You will go open malak, row istiqbal, open malak, sawihada, sawi patura, then row muktabar, sawidam. Wait. Yeah, you already? It's okay. You already use this? Yes. No, you need to put date and then detail. You already? You already finished? Oh, yes. Okay, give me the copy, the last one. Yes. Put your vaccination. Okay. Date. Okay. Pass. Okay. Give me that. No, you will answer that. And then you need to move on.
My name only? Wala my stuff only po.
The name, type, number, and then detail.
And this?
One,
You give me drink. No.
okay. You share with son, give it to me. I will show you what to look for. Next. This is you look what we have filed. That's right. I need that. What's this? Yeah, your date when you do the vaccination. Even you're not here. Yes. No, because
Yeah, it's okay.
it's no problem. Just date or year later.
Can you use
It's okay.
the year first time or not?
Later. You don't come vaccine before.
Yes.
You did not have last year. But you know, you happy? You don't know. See, module. And then your. Where is that? Sali ko yeah, I know. Then sorry. My brother. Next. Yes, yeah.
Yes.
That's a serious. Oh.
cannot remember things that you are serious or I'm just joking. It's just like, because if we have, we have problem, because the last year we have, massive, when we say massive, we have program for immunization and we come here. So I want to make that, but we should have the appropriate course to do that. That's why we are in this. This is okay? Yes, it's okay. Yes. Okay. Okay. So you're the last one, so I see. So we don't have the visa. Much fun. Lucky the visa. That's funny. Before take that and that 2011, that and this is one. So 2011. This day is 20. And here, the last year, we have started Chinese screening. Oh. That medical checkup, not that in this checkup. What? Medical checkup, not this. You know that? Yeah, yes, I done. In this, what did you have done? This, see the change. They go look. Yeah. Jadi kami proses yang dilakukan. Sudah bisa proses okay. Nah, kalau first where you do this one. No. You must have like this record. The name, the date of birth, the number 6. Male or female, then the department, position, then the our nationality, contact number. Okay. I put in this one. Yes, no, in the second session and next week, every Monday, maybe every Monday you come, because you see our stories. Every Monday? Yeah, every Monday, 1 p.m. Oh, no, every Monday. It's already in the post in the Basma. I have already memo. It's you see the memo in the Basma and every Monday you will come here. Okay. It's very it's many. Yeah. The social measures, especially our EKI. You must learn the EKI. Sure. And this is our especially I see you. Because you are new. You need to eat after it will help to you. And I will learn it before, of course. Maybe in time you will be there. You will replace me there. You will be the one to replace me there. Yeah, inshallah. Because next time I will bring the form and you see that already Susan in the stairs. Okay. Thank you. Monday now. Inform your other because I will post this now that this I will post it that and then what I does the last. Okay. Thank you.
Now we already finished the first session and second session, and I will come back on Monday. Every Monday, I already have scheduled for them. So for only for those for the nursing staff. And then for tomorrow is my schedule for CSSD staff. Alternate on the second week is the housekeeping again, housekeeping staff. And thank you for watching and see you tomorrow. If you need something to us regarding infection control issues, just comment below and post your questions. Thanks for watching.